The Oklahoma Department of Mental Health and Substance Abuse Services was one of only 8 state agencies that received an increase in its state appropriation for next fiscal year. The $2 million extra are for operations and will do little to address the estimated 950,000 Oklahomans who suffer from mental illness or addiction. For now, the agency is using a triage approach to determine who gets care and who has to wait. This report was prepared in collaboration with Oklahoma Watch.
Triage is defined in medical terms as determining the priority of patients' treatments based on the severity of their condition when resources are insufficient for all to be treated immediately. Triage is common to the battlefield, accidents, or natural disasters. But in Oklahoma, that's how people now get treatment for mental illness or substance abuse.
We have people every day that try to access services that call and say, I need help. And we have a priority list. As a government-funded facility, we have a priority list. If you are an IV, pregnant, drug user, you get preferential treatment over everyone else.
Janet Cizik is CEO of the Center for Therapeutic Interventions, which has community mental health facilities in Tulsa and Bartlesville.
There isn't enough funding to help people who have moderate issues. So we absolutely are treating the sick of the sick, the people who are, on death's door if they don't get access to treatment.
The Oklahoma Department of Mental Health created a priority system that is much like treating those on the battlefield. Those most in need are treated first. The rest have to wait. Terry White is commissioner of the Oklahoma Department of Mental Health and Substance Abuse Services.
Because we only have enough resources to reach about 1 out of every 3 Oklahomans who struggles, we have to decide how to use those resources. Well, obviously you serve the people who are most ill.
And the result is to get treatment for mental illness or addiction in Oklahoma, you have to get sicker quicker.
But what that also means is the people who are in early stages where we could catch mental illness with early identification, intervene early, and hopefully divert a lifetime of struggle for them, don't have access to care because they're not sick enough.
Teresa Deck worked in a community mental health facility for many years. She is now director of counseling at Sunbeam Family Services in Oklahoma City. Sunbeam offers counseling services only to the mentally ill. There's no state contract and no prescription drugs. But they see the people who have shown up at those community mental health facilities and been deemed not yet sick enough. Sunbeam is the last stop for those patients, and its services cover just Oklahoma County. Without some kind of treatment, Deck knows what will happen.
Usually they will end up getting worse. Their symptoms will get worse. They can have marital problems, they can have problems with their children, behavior problems, problems at work, not being able to keep a job.
Verna Faust is executive director of Red Rock Behavioral Health Services, one of the largest community mental health facilities in the state. In recent years, the number of new clients seeking treatment has increased dramatically.
In the last probably 2 to 3 years, particularly in Oklahoma City, we have seen unprecedented numbers of people coming here wanting services.
Because of privacy issues, showing people seeking treatment for mental illness or substance abuse is not possible. But the number of cars in the parking lot gives a sense of how many people Red Rock serves every day. The flow of people is virtually non-stop. Faust believes the economy is partly to blame for the increasing client numbers, but another reason may well be directly tied to the get sicker quicker triage approach that the mental health care industry has been forced to implement.
We don't treat people when people very first get sick. So they go for long periods of time, and by the time they get here and they're seeking help, they're really sick.
Verna Faust, Teresa Deck, Terry White, and Janet Cizik all had the same response when asked what it will take to end triage treatment of the mentally ill and address the need like any other health problem. Summed up by Tracy Cook, Executive Director of NAMI Oklahoma, the National Alliance on Mental Illness.
We don't have the funds to do the intensive outpatient treatment that people need.
Oklahoma spends about $53 per capita on treatment of the mentally ill. The national average is about $120.
We're second in terms of highest rates of mental illness, and we're about 48th in funding. That says it all. It's going to take money.
Faust says the people who work in the state's mental health system do a great job, and there are success stories every day. Statistics from NAMI show that 80% of those who get treatment for mental illness or substance abuse go on to lead normal lives. The problem is, the 80% who find healing are only a fraction of the number of people who need treatment, but cannot get it unless they get sicker.